So we use the term dementia, but I understand that is a term that covers a lot of different diseases and conditions. Could you tell us a little bit more about that?
Yes, that's right. Dementia is an umbrella term. It's what we call a clinical syndrome. It's the memory loss symptoms and a lot of other symptoms that occur and can be due to lots of different diseases. The most famous, of course, is Alzheimer's disease. That causes more than half the cases of dementia, so more than half the people that have Alzheimer's disease, particularly older people. But the other major causes are Lewy body dementia, vascular dementia, and in younger adults, frontal dementia. And those between them make up the vast majority of cases. And then there's a lot of other rarer diseases that cause dementia as well.
So can you tell us some of the typical symptoms of dementia?
The hallmark symptom that I think everybody is aware of now is the memory loss. And that's most characteristic then of Alzheimer's disease. And so with people with Alzheimer's disease, we get a very typical pattern of onset, particularly in older people, where memory is the prominent symptom and the one that brings them to the doctor in the first place. With other causes of dementia, such as vascular dementia and Lewy body dementia, then other symptoms can be the most problematic symptoms early on and the ones that cause them to see the doctor. So it's not just memory symptoms, it's other things. So for example, I will usually be referred to somebody with dementia who has memory loss written in the letter from their general practitioner. But often I will be sent a letter from somebody who is said to have depression or depressive symptoms. And that is the concern that the family or the patient has. And in fact, a lot of those people don't have the clinical syndrome of depression, a depressive illness. They have dementia, and the depressive symptoms are an early feature of that. And it's probably depression as well as memory that's the most common way in which people would come to see a specialist like myself.
And are there any treatments?
Treatments for the symptoms?
Yes.
So, yeah, we distinguish between treating the symptoms and treatments of the diseases themselves. So there's a syndrome of dementia, there's different diseases. And so there are symptomatic treatments like for depression, where we could use either a psychological approach to managing the depressive symptoms or drug treatments, antidepressants for those depressive symptoms. If somebody has other problems like difficulty sleeping, again, we would look to have a non-pharmacological approach to help people to sleep. But if that doesn't work well, then we would again look to use drugs to help people sleep, so-called sleeping tablets. So we have symptoms that we recognise and target with specific drugs or non-pharmacological approaches. In terms of diseases then, there's treatments being developed, but at the moment, unfortunately, there aren't any what we call disease-modifying treatments. That is, a treatment for Alzheimer's disease that will stop the disease itself or even reverse the disease process in the brain. There are a lot of drug trials going on trying different new treatments, but at the moment there's nothing available for people to help with the disease itself, Alzheimer's or sadly any of the other major diseases either.